A diphtheria outbreak in Rano local government area of Kano State has raised serious concerns, with at least 50 people reportedly dead and several others hospitalized. Now, the outbreak is said to be particularly severe in Ridin and Sabuwar Qaura communities, as residents face the growing threat of the highly contagious disease. The Kano State House of Assembly has now called for urgent intervention, directing its health committee to engage with the Ministry of Health and ensure emergency support reaches the affected communities. Now, to get a clearer picture of the situation on the ground, our correspondent, Stephen Enoch, is in Rano local government area at the moment. Good morning, Stephen.
All right, Stephen, let's start with the situation on ground. What is it looking like and how serious is the situation in Rano right now?
So currently, I'm in Rano local government area. A few moments ago, I was at the hospital, and at the hospital, they told me that they have not had, cases of much cases of diphtheria. And I'm wondering, okay, so why would the lawmakers say they have so many issues of the diphtheria? So I went outside the hospital. I spoke with some people who confirmed to me that yes, they had issues of diphtheria, and currently, people have died of that particular disease. And I'm standing just in a few meters away from me. It's the shop of a local, medicine man. And what they do here is that when they have this diphtheria, there's a thick substance behind the tongue that surfaces. So what happens is some of them don't go to the hospital. They go to the local traditional medicine doctor, and he uses a blade or something to cut off that substance, and these people go back to the community, and before you know, they mingle with children, and those children contact this disease, because cutting it off doesn't mean that the person has been free from the disease. I'm speaking. There's someone who speaks with me now who has someone that had contacted the disease and also taken the person to the local doctor. Now, so ya wannan cuta ina ta damun ko anan kuma ya kuna shiga wajen gargajiya da ana tura ana cire wannan abun.
Akwai wani bafulatani makocinmu na je sai yake cewa akwai yaransa da yake yin irin wannan cuta, shine nake ba shi shawara. Akwai makocinmu anan ana kawo masa wanda suke irin wannan cuta, yana sa magani yana cire musu a gargajiyance. To da na gaya masa dai, amma shi bai zo ba, amma akwai wanda suna yawan zuwa gurinsa su zo ya cire musu. Yanzu ma dai bai fito ba, sai dai idan kuna da buƙatar ganinsa ko kiransa ne ko kuma ko wani lokaci kuna dawowa sai a ga ya masa bayani. Mu ne Alhaji Alhassan Jangaru.
To kamar mutane kamar nawa ka san sun rasu saboda wannan cutar?
Akwai mutane da yawa wanda suna rasuwa wanda kwanansu ya ƙare. Kamar mutane kamar 10 haka ko sama ma dai wanda lokacinsa yana zama sanadin ajalinsa.
Na gode. All right. So he said that he confirmed that the person, the traditional doctor who removes that substance, is just here, and if you can wait, we would see him. So he also made mention of the fact that he confirmed that he has, he know of people that are around 10 and above. The figure 10 and above people who have died due to this diphtheria outbreak, and it's something that is very worrisome. Although the Kano State Center for Disease Control said that they have recorded only 32 cases of diphtheria in this local government, but it appears that it is more than that. I'm going to speak with someone else who will tell me how it is a burden to them. His name is Aliyu Saleh. So ga mana ya wannan abin yana baku wahala a nan Rano.
Gaskiya wannan abu yana mutukar yana wahalar da jama'a sosai fiye da baka tunani. Sakamakon daga lokacin da abu ya samu mutum irin wannan lamari har mutuwa ma ana yi. Saboda dalili na farko dai kaga duk lokacin da aka ji ya samu mutum irin wannan abu bai iya cin abinci, bai iya shan ruwa, sannan kuma zai ga cikin damuwa fiye da baka tunani, karshe ma ina iya daukar mutum.
So he said the same thing, that people die of this particular issue, and he made mention of the fact that some people, when they have it, they will stay in the house, they cannot eat. So if someone cannot eat and the person is still in the house, how can the person be cured of this? And while I was in the hospital, someone told me that, some of them prefer to go to the local traditional medicine doctor, whatever they call them, because they feel they can, get healthcare easier there, faster, cheaper, because when they receive any of this distress call, at the hospital, they refer them to Kano Teaching Hospital in Kano State, or the IDH, that is the Infectious Disease Hospital in Kano State, and it's a very, very, very long distance from here. So most of them prefer to use the local doctors, and it is, killing most of them here. That is what I have for you at this moment.
All right, Stephen, let's quickly also talk about the reported deaths, because we've been hearing that there are at least 50 deaths that have been tied to this outbreak, and they happen to be children. Have you been able to independently establish the scale of the deaths and the number of the people currently hospitalized? Because it's quite interesting for you to be hearing that it's just about 30 cases of diphtheria that they have identified so far.
Okay, so here in the north and in Islam, if someone dies, the person is buried immediately. So at the hospital, they don't have that statistics. So at the IDH, which houses the Kano Center for Disease Control, they don't have that statistics, but the lawmaker said over 50 have died here. And when I spoke with my respondent, he said that he knows about 10 or above who have died from this particular disease. So from here, we are going into the community, into the hinterlands, to hear from the locals, those who have died. And someone here spoke to me about his neighbor's child who died of the disease. But we are still in the town in Rano. We'll go to the villages where this thing happened, and if possible, we'll go to the grave sites of the people who have died as a result of this particular disease. So it's something that we are going to go in there and verify. The hospital, that is Rano's General Hospital, is not far from here. It's just about 1 kilometer from here. So we will go to the community and find the real information and to know the amount of people who have died as a result of this particular disease.
All right. What is the response from health authorities so far? Because you did say that, some of them go as far as cutting off the disease from the tongues. Are the affected communities receiving medical attention and emergency support that they need?
All right, so according to the DG of the Kano State Center for Disease Control, that is the issue they are facing, because most of the people who died as a result of this do not report, which means they need to be, a heightened level of education on this, because some of them, when their child, is passing through this, they'll take them to Gargaji, that is a local doctor, he removes it. After a while, maybe the person spreads it across different children, or the person later dies. Okay, they'll say maybe it's something that comes from God, and then they bury the person. It's something that's very disturbing, and I know the ministry is doing their best to ensure that the people report these cases, because sometimes if you're not literate enough to understand this disease and to report it, then these deaths will keep on happening. But I believe that people need to be, educated properly on this disease, so that they will, prevent this number of deaths that's happening, because the deaths that are happening are unreported or underreported, because the ministry don't have this figure. It's just from the streets, a neighbor, person, son dies, this person dies, that person dies, no record to show that someone has died, but they are sure of this number, and we're good to ascertain the fact of the situation.
Stephen, we want to thank you for the updates, and we hope that this situation can be handled as quickly as possible and can be ameliorated as well. Thank you.